Good evening, folks. This is Dr. Paul. Thank you very much for tuning to our channel today. Today, I'm in a very, very sorrowful day, and I am visiting Auschwitz concentration camps in Poland. This is located near Katowice, Poland, and it's a very, very sad experience for me. And as I was going through this camp, and I am particularly saddened by how human beings were treated based on their race. I mean, how people were brought here in trains and against their will, separated from their family members, and then once they get off the train, a doctor would stand in the train station and decide their fate. And people were taken, some to the right where they could go to a labor camp, or some to the gas chambers where they are exterminated, or some to the medical experiments by doctors. So this is a place that has relevance for us in 21st century as we think about medical ethics, because as I walked through this place I saw that every medical ethic you are supposed to follow was violated. Every medical ethic was violated. And I want to spend a few minutes to talk about these important things. When we treat patients, there are two fundamentally important ethical principles we need to remember. Number one, respecting the patient autonomy. Respecting the patient autonomy. And number two, acting in the best interests of the patient. So number one, respecting patient autonomy, that was completely violated in this place. People were brought here against their will, and when they were brought here against their will, the doctors acted like gods. Like if they examine the patient and say, now you can go to the forced labor camp, you can be executed in the gas chamber, or you can go to the medical experiments by Dr. Mangala and his colleagues. These doctors were experimenting on human beings, like how a twin, how the effect of a disease on a twin. For example, Dr. Mangala would take two little babies and he will inject a disease or a chemical into one baby. And when one baby dies, he will immediately kill the other baby and do the autopsies on both babies to study the comparative anatomy and comparative pathology. So you see the heinousness of these doctors. These are the best doctors, the best scientist doctors that Germany produced during that time. And without any conscience, they came and killed these Jewish people. And the second thing I want to is like acting in the best interests of the patients is the most important ethical medical ethics we need to remember, and that is also been violated. Then there is confidentiality has been violated because people were stripped of their clothes, and there was no confidentiality was given to them. They were taken into these experiments and they were starved to death to study the impact of starvation on the metabolic functions of human body. And the other medical ethic I would say is informed consent. Nobody gave informed consent for these experiments. The other thing is fairness. They were not given fairness. The other medical ethic is like honesty. These people were lied day in and day out. They were deceived into these experiments. And above all, the justice. And you see, when we say justice, that means like as a physician, you are supposed to treat people no matter what is their race or religion or a gender or their social status. You need to provide health care, and you should not even consider their ability to pay. But that's not what happened here. Justice was violated because these people were selected for the medical experiments based on their race because they were Jews. I mean, these experiments were not done on German people. They were done only on Jewish people. So justice has been violated at Auschwitz. So you see, all medical ethics I can think of, patient autonomy, acting in the best interests of the patient, the informed consent, the confidentiality, and honesty, and then above all, the justice that when we mean justice is like you should not consider a race or gender or religion or place of origin or national origin of a person when you treat them, but that has been violated in this place. And when I went to this place, I mean, it's a sobering place. I went through the halls, and in some of the halls I saw children's shoes, and th- there was a whole pile of shoes. I walked a big hall. I mean, as I walked through, these shoes of different people, they're still there, like tons and tons of shoes, and I was speechless. And in another hall there was tons of hair, and the victim's hair was removed and it was sent to the textile industry and other industries. And I went to a hall where little children were experimented, and a baby just 2 years old was used to see how that baby would respond to starvation. Another baby was used to see how that baby would stand the temperature changes. She was frozen to death. Another baby was used to see the impact of different infectious diseases. Like hundreds, I mean, not just one or two. Literally thousands of people were used in these experiments. And you see, why did these people do this? Because the doctors who were here, they were trained in Darwinism. They were told that human beings are like, they just evolved, and whoever has the power can do whatever he wants. Survival of the fittest, we read in the evolutionary ethics. And they forgot that there is a God to whom we have to give an accountability. So you see, in a creationist worldview, there is a God, and that God gives significance to every human being, and you are not supposed to violate their sacredness that individual human being has. But Dr. Mangala and his colleagues were trained in Darwinian evolutionary worldview, where they were taught that we are all just evolved animals, and there is no God, there is no accountability, there is no sanctity or sacredness to human life, and you can do whatever you want to do to human beings, and in the name of welfare and greater purpose to humanity, you can do whatever you want to do. So these people were atheists, and they were trained in evolutionary worldview. That's the basic thing happened. And they also highly discriminatory against a group of people based on their race. And they are also in the name of science, you could do a lot of harm to humanity when you remember that science has its own limitations. Yes, you can do a lot of things. You see, Dr. Mangala and other doctors who worked on these human experiments, they were using the highest forms of reason from philosophy, sociology, science, history to defend their experiments to the world. They're saying, we're doing this for humanity. But you see, folks, you cannot use to justify the end. You need to be careful what means you are using. You cannot abuse human beings in the process of helping other human beings. But that's what exactly happened at Auschwitz concentration camps. Innocent human beings were put to medical experiments in the name of science. And what we need to remember is that doing science itself is not the end. And we need to remember what are the values, what are the moral values we are following when we do science, when we practice medicine. So Auschwitz is a place where you can see every medical ethic was violated. Every medical ethic was violated when doctors, devoid of conscience and moral values, did whatever they want in the name of science. Hopefully, this lesson helps us, because when I entered into Auschwitz, there was a saying by George Santayana: those who forget history are, are prone to repeat the same mistakes. Those who forget the history are prone to repeat the same mistakes. So we hopefully we don't repeat the same mistakes in the name of science. Thank you.